All right, so the next thing we're going to do is a nasopharyngeal airway. Before we start any procedure, we want to make sure that we follow any federal, local, state laws, any facility policies and procedures. We want to make sure that we use proper body mechanics. We provide privacy. We also do proper body mechanics. We do proper hand hygiene. And we also make sure we identify our patient the correct way according to facility policy. First thing we'll do is we'll come into the room, we will introduce ourselves, we will wash our hands, we'll let the client know what is going to be going on. Then we will make sure that we provide privacy, and then we will start the procedure. Alright, so we want to make sure that we put our client in either a supine or a semi-Fowler's position. We want to assess the nose. We want to check for patency, and we also want to check for a deviated septum. If there's a deviated septum, obviously we don't want to use that nair. So once that we have that, then we need to make sure that we measure our airway, or our airway here. So we go from the tip of the nose, the tip of the nose to the earlobe, and you want to use an airway that's about 2.5 inches longer than your measurement. The airway actually should be slightly smaller than your nair. This one is a pretty thick one. This will not fit in the mannequin's nose, just to let you know, but I will show you how to measure. So before we actually go to insert this, then we want to make sure that we lubricate with the water-soluble lubrication. Lubricate that very well. And then we want to tip the head back and hold the nose. And we want to insert it along the floor of the nose, and we want to place it. If they start to gag or anything like that, we want to check our placement, and we would check our placement with the pen light, have them open the mouth, and we look in there and check for placement. So when you have advanced this down into the nares, you advance it and until it is flush with the nostril. You want to check the placement on the posterior pharynx at the back of the mouth, behind the tongue. So then once you have that, then if you meet resistance by any chance, just kind of rotate it a little bit, but never force. Now, if for some reason that you have a client who starts to gag, they have a spasm, it may be that your tube is too long. So this is where you need to make sure that you have your suction in place. So to make sure that there is air movement, then you would want to close the client's mouth, and you would want to put your fingers at the tube's opening to check for air exchange. Once that is done, then you need to auscultate the lung sounds to make sure that it's not down into the lungs. And you want to make sure, or not make sure it's in the lungs, but you want to check for bilateral lung sounds. And then you would actually want to remove the tube every 8 hours to provide suctioning, also to give that time to rest. And then if possible, then you would want to switch sides so you don't end up breaking down the skin on that side by using just one side.